Hi, everyone, and welcome to episode 229 of the Tick Bootcamp podcast. The title of today's interview is LymeTV, an interview with Adina Bercowicz. My name is Richard Johannesson.
And I'm Matt Sabatello.
Matt, Adina is one of the stars in the Lyme disease community, and we were anxious to get her onto our podcast. And finally, that date had arrived. And I was really looking forward to challenging Adina on a number of different issues. And I have to tell you, she was up to the task. It was a really exciting interview, and I really enjoyed challenging Adina on many different fronts.
Rich, what really surprised me about Adina's Lyme journey is the fact that she talked to us about having to separate out Lyme doctors versus other specialists. When we talk on our podcast, we generally focus on people that specialize in Lyme disease, but Adina emphasized the point that we have to look for other specialists to address the other things we have going on, either as a consequence or damage from Lyme disease, or other pre-existing conditions we have that were amplified once we became sick.
Matt, like you, I really enjoyed the element of Adina's podcast where she talked about teasing out the symptoms and the issues that she had to deal with in addition to Lyme disease. In so many cases, folks believe that once they have a Lyme diagnosis, everything that's going on with them in their lives is related to Lyme disease. And Adina was able to tease out those elements of her illness that were related to Lyme and those elements of her illness that were not related to Lyme. And she was able to build a health team so that she could get better. And this is a wonderful model for anyone who's on a Lyme disease journey. So Matt, I'm really excited to introduce Adina Bercowicz and LymeTV to the Tick Bootcamp community. Hey, Adina from LymeTV, and welcome to the Tick Bootcamp podcast.
Hi, thank you guys so much for having me today. I'm super excited to be here.
Well, you have been somebody that we've targeted for interview for a long, long time. So it's great that we finally have an opportunity to interview you just before Christmas of 2021. It's just, it's like our Christmas present having you on our podcast. So thank you for taking time away from your family and all of the great work that you're doing at LymeTV to meet our community. So Adina, talk to us about first where you are from, where are you currently living?
Currently, I live in Portland, Maine. However, I am from away, as what Mainers call it, from originally Miami, Florida, and we have been here for about 4.5 years so far.
So you went from as far south as you can live in America to as far north as you can live in the US.
Yeah, from one point of I-95 to the other.
Holy cow. So, yeah, I mean, at least in New York, we generally consider people from Maine really Canadian. So it's it's interesting that you've gone so far north, and not only will there be huge cultural differences, but I guess the temperature is radically different. You went from a place where it could be as warm as you could be to a place where it can be as cold as you can be. So, Adina, talk to us about what your childhood was like. What was it like living in Florida?
Well, I was very independent as a child. I didn't have a well-structured family. I didn't have very attentive parents, I would say. My parents, I guess they divorced when I was 6 years old. So my mother worked a lot and she had her own health conditions and issues that I really didn't understand as a child. So I had to be independent at a very young age. I had a younger brother who was 3 years younger than me. Unfortunately, he passed away in 2015. But as I was growing up, even at 10 years old, I would help him with his homework and help cook dinner and keep the house clean. So I would say at a young age, I had to be an adult. I didn't have much of a childhood.
So you're an old soul and you were doing all the things that needed to be done to take care of yourself and your brother. And there are some virtues that come along with that. And I think we're going to talk about that a little bit during the podcast. But so talk to us about what your educational experience was like as a native of Florida.
Yeah, well, I always had an aptitude for math and science, and I always did well in my classes, actually. I was a straight A student all through elementary school and junior high and high school. I was a bit of a nerd. I'm a perfectionist and an overachiever, and that's been, characteristic, I would say, character traits that I've had my whole entire life. So I've always done well in school, and I, at a young age, knew that I actually wanted to become a doctor. I wanted to be a neurosurgeon. In the 5th grade, it was something that I just knew I wanted to be. And so I kind of focused my earlier education in junior high and high school on taking the courses that I need to get into those courses in college. At a young age, I was so good at math actually that in 5th grade, I was taking high school algebra. And by the time I reached high school, I had already finished all of my high school math courses. So I was taking extra science courses as electives.
So you're a geeky kid who loved math and science and wanted to move into the healing professions. And that, of course, begs the question, at that time in your life, when you were studying math and you're studying science and you had this spirit of wanting to be a healer, did you know anything about ticks or tick diseases during that stage in your life? Because we do know that Florida has a huge problem with tick diseases, even during your childhood. Was that something that came on your radar, either in your science classes or your health classes, or in any of the independent work that you were doing to prepare yourself to become a healer?
I had never heard of ticks or tick diseases as a child. In fact, I never heard of Lyme disease until I was diagnosed with it. So I did not know that there were dangers from ticks, and I certainly didn't know anything about ticks being in Florida at that time.
So talk to us about how your life changed when you finished your youthful experience in Florida and you went off to college.
Well, actually, I didn't go right off to college after high school. I had worked in a record label industry, in the music industry for a little bit as a coordinator for a record label. So I traveled a lot and I was making a really good salary for somebody being so young. So in my early 20s, I was kind of focused on my work and foolishly built a very large home and had a mortgage at a young age, which I would advise any young person not to do regardless of their salary. And so during that time, I did end up enrolling into college. And at that time, I did not pursue a pre-med major, which I had expected to. I was more interested at that time in network systems and with Unix and operating systems. So I actually started courses for computer science and went through also some certifications for Microsoft to become Microsoft certified. And I was pursuing more a computer science track. And then it wasn't until much later in life when I went through a few changes of careers that I ended up going back to school. And then I pursued, I was a multi-major. So I graduated with multiple BAs at once. I graduated with a BA in International Business and Trade and Marketing and Operations Management from the Florida Atlantic University.
Congratulations. So let's walk that back a little bit, because this is a really interesting path, right? So you're a young child, you're a young woman with math and science skills. You have this goal to become a healer, but you now take a different path, right? You become a professional in the entertainment industry. So talk to us about how that path developed for you and how the little girl with the strong math and science skills became a professional in the entertainment industry.
Well, that was actually, kind of short-lived. That was only about 3 years of my life. And again, on the side, I had my sights on focusing on network systems administration. So I was doing it more just for a paycheck. It wasn't something that I knew I wanted to pursue later. Through this whole process, though, and even as a child, I always was also very focused on volunteering with nonprofits. As a child, I volunteered in nursing homes, reading to the residents, and I would also volunteer at food banks and homeless shelters, especially during the holidays when they had larger amounts of people who needed to be fed. So that was always something that I had passionately within me, was that call to service. So through the time that I worked at the record label, I wasn't really focused on that as a long-term career trajectory. I did that business, actually, that company that I worked for actually went out of business, and I think it was like 2003. So at that time, I accidentally fell into the finance industry and into mortgage loan processing. I did very well with the mortgage loan processing, and quickly kind of moved up the ladder of where I was at. So I started my own business for mortgage processing, and I had national banking and mortgage houses that contracted my corporation for compliance audits and lending processing and other types of professional services that my business did. So I was then in the finance industry for several years, doing very well. And then, of course, when the recession of 2008 started, which actually began in 2007, the banking industry and lenders started seeing the banks going bankrupt, and the mortgage brokers started going out of business. And those were my clients. So as they were, like dominoes going out of business, I eventually shut my business down at the end of 2008. And that's when I returned to school.
So you've had this very interesting career path where there were a lot of things working on you as you were working on them, right? So this little girl who wanted to be a healer, who wanted to study the human system, had this now call to service, and she also started to learn about different elements of the entertainment industry, which we'll talk about as we get later into your story. You learn about about entrepreneurship and you had the spirit of service from an entrepreneurial model, and now you pivoted back over to college after you learned all of those different skills and learned so much about yourself and how you could apply these strong math and science skills. So talk to us about what your passion was when you were becoming this, you called it multi-major Bachelor of Arts student, and what your vision was for your future while you were a student for the first time.
I wanted to just apply what I learned in school to what I already knew as an entrepreneur and a business owner. Through all of my studies, I actually thought about how can this help me become a better business person based on what I already know and my own experiences. Because I went back to school and I was a little older than the rest of the students, I had that experience under my belt, and it gave me a different lens on looking at how I learned from my courses. I did graduate with all of my degrees as an honor student. Again, that comes back to being a perfectionist and an overachiever. I took 6 courses a semester while I worked full-time as well, because I wanted to push through, and get my degree as fast as degrees as fast as possible. Through that time, I did, though, want to still pursue a life of service, and I started to focus my volunteerism more into different types of nonprofits. Again, it was usually focused more on the underserved communities, is where I really had a passion for my volunteerism. In 2010, I volunteered with the University of Miami's Project MediShare as lead logistics post-earthquake Haiti. At first, I was managing outbound logistics from an airport in Miami to send all of the medical equipment and like X-ray machines and surgical room equipment to Port-au-Prince, where the MASH hospital was being built. And then I was asked to manage the incoming logistics, inbound logistics. So I, asked, when do you need me to go? And they said in a few hours if you're able. So I rushed home, packed a duffel bag, headed back to the airport, and flew to Haiti. So that was my first trip there. I was lead logistics for inbound logistics for setting up the MASH hospital. I also was trained as an emergency OR tech, so I was assisting the surgeons in the hospital. I was the only non-clinical person going on medical rounds at different hospitals in Port-au-Prince with small teams. So I was also trained as an emergency kind of like a wound care nurse, and I was helping clean wounds from people who had amputations and things like that. So that really kind of reignited that fire of my passion always as a child of wanting to work in the clinical field as well as giving back for that service. So that was the start of that process.
So, or it was the next step in that process, right? Because there is a thread that ties all of this together, Adina. I'm not really sure that it's as disjointed as perhaps my questions are suggesting it is, because you sort of have this thread of service that begins during childhood. You have this thread of wanting to serve people who are in need, medically in need. We have this thread of systems analytics and systems I guess improvement. So we sort of see these same threads all developing during your childhood all the way now through this time when you're in Haiti. So after you finished your mission in Haiti, what was the next step in your career path?
Well, I did go to Haiti many times, and over a course of a couple of years. But in 2011, I was introduced to a founder of an organization, an educational nonprofit in Calcutta, India, and I started working with them. So I was the chief financial officer for about 5.5 years for a nonprofit in Calcutta, India. During that time, we also expanded our location to Pune, India, which is on the other side of the country near Mumbai. I would travel back and forth to India, but mostly I managed the teams from Miami remotely, which, served well on managing teams now through the pandemic, right? Like remotely. I really loved my work. I worked on creating a sustainable organization and creating sustainable programs. I also worked on improving the educational programs that were already in place, and I got to meet a lot of wonderful people who I'm still connected to and friends to this day. I really did enjoy that work that I had, that work of service that I was giving.
So, Adina, it's my understanding that it's during that window of your life when you first started to now get sick and you started to develop the symptoms of what you now know to be Lyme disease. So talk to us about how your symptoms developed and how your symptoms were impacting the good work you were doing for the folks in India.
Yeah, so, I'll precede all of that with saying that I had a really bad pregnancy, and I actually found out that I was pregnant while I was in India. And so I had some previous pregnancy losses. And so while I was in India, I was being monitored for that. Had my first ultrasound. I had to go to the hospital every couple of days to have my blood drawn to make sure that my titers were doubling that as needed to show that the fetus was growing properly and that I wasn't having another loss. So at that time, it was really hot. It was really, really hot in India. It was like 114 degrees, and I was working out in slum communities doing medical rounds. And I decided that it was probably best for my health and the health of the child to come home. I didn't go back to India during my pregnancy. So I had some autoimmune diseases that were diagnosed during that time. Also, a few years before I became pregnant, I had a thyroidectomy. I had a sudden onset of Graves' disease. My thyroid grew into a really big goiter and caused thyroid storm. So I had an MI. I had a mild heart attack in 2009. So during my pregnancy, because of all of this, I had to see a perinatologist who is a doctor who monitors the fetal health, and of course other specialists like a cardiologist, my endocrinologist. I had to see everybody more regularly, and they were monitoring to make sure that the child or my baby was growing healthy, and that that the baby was getting enough thyroid hormone through my synthetic hormones that I was taking, and that kind of thing. So I went through having a lot of pain. I was in excruciating pain through my pregnancy for most of it. I gained an extensive amount of weight, and nobody could figure out why, because I was not overeating. I gained, like, at one period of time 10 pounds in 2 weeks, and I was then told at that same time that I wasn't even eating enough calories, to promote a healthy pregnancy. And I'm like, what are you talking about? I'm blowing up here. Like, I look like Shrek, like I'm eating myself. So it really was an unpleasant journey. I also started developing weird things that were happening to me. Well, not so weird, very common in pregnancy to develop depression. So I started having symptoms of depression, but I also became allergic to my hypoallergenic cat. And I also became allergic to soy products, which I had never been allergic to before. So there were all these weird things that were happening. And yeah, it was just a really bad pregnancy during that time. I didn't really think about the other symptoms and didn't realize that they were all connected until my son was about 2 months old. So it was in February of 2014. And my husband and I were going for a walk with the stroller around an area near our home in Miami that has a 4.5 mile walkable track around some golf courses. And so we were just taking a stroll to go for a walk, and I couldn't go for the walk. I had to sit down at every bench along the way. And I told him, I don't feel well. I feel like I'm encased in a cement suit. I can't move forward. We're going to have to call a taxi to come home, because we lived a few blocks, just a couple blocks from the golf courses. So I was like, I can't make it back home. And that was the first realization that something was wrong. And even on a trip to India shortly after that, I recall telling one of my colleagues that I just didn't feel well, that I wasn't well, something was going on, that I was tired all the time. And this person said, well, you're getting old. We're all getting old. It's probably that. And I said, no, I think something's going on. I just don't know what it is yet, but we'll see what happens. And then, of course, my symptoms progressed from there, and we could talk about that in a minute. But it was ultimately a severe health decline of why I had to resign from that position in late 2016.
So Adina, let's talk about what was going on in your life during that window, right? So first of all, do you recall ever having been bitten by a tick either in Florida or any time when you were traveling to Haiti or to India?
No, I never saw a tick on me. But what I can tell you is that I was healthy before my pregnancy, and I was at the top of my game. I was doing spin classes between all of my classes and full-time work, Muay Thai, which is a mixed martial arts. I enjoyed doing that to stay fit, and yoga. And I was just, I didn't have any cognitive issues. I was sharp. Everything was fine. And I became sick through my pregnancy, or at least we attributed those symptoms to, ongoing autoimmune diseases that I had. But I know that I got bit during my pregnancy because my son was actually born. We found out later when he was 2, he was born with the exact same strains of all of my tick-borne diseases, just like a fingerprint map. So we know that now, looking back, that I was bitten during pregnancy. but I never saw a tick on me.
Well, now, Adina, why do you know that you were bitten by actually, let me ask the question a little differently. Why do you believe that you were bitten during your pregnancy? Just because your son and you have the same strains doesn't mean that you aren't harboring those strains for some longer period of time and you just pass them on to your son congenitally. It doesn't necessarily mean that you were bitten during pregnancy, right?
That's correct. But I had other known autoimmune diseases and medical issues, and I did not have those type of same clinical symptoms. And I really do not think that I had anything that was dormant because I think it would have been triggered. I think I would have had some type of symptoms based on me not being in 100% health already. I don't think that I just don't think that I
But
had any type of recessive or something that I was harboring, and then it triggered. I really did start becoming really ill during my pregnancy.
so, Adina, but let's focus on that a little bit, right? So, because one of the first things that I thought of when you were sharing with us that your mom had been ill during your youth was that perhaps she had Lyme disease, and perhaps you had received your Lyme, your various strains of Lyme or the various microbes congenitally, the same way you passed it on to your son, and perhaps all of these things that you're distinguishing as pre-Lyme autoimmune diseases, for example, were in fact part of your Lyme journey. So talk to us about why you think that perhaps these previous diagnoses are not really a part of your Lyme journey.
Well, my mom never had tick-borne diseases. Unfortunately, she suffered a lot from bipolar disease, but also mostly from substance use disorder. So her symptoms and her health issues were not from tick-borne diseases.
Well, but let's pause there for a second, Adina, because you may be right, you may be wrong, right? Because, and again, I don't want to challenge you on your family history, but if you don't mind talking about this, one of the things that we keep seeing pretty consistently is that people who are harboring Bartonella are suffering from mental health issues, right? And we also know that the neurological changes that come along from other tick diseases will cause you to have mental health issues. And we know that suicide, for example, is predominant in folks who have tick-borne diseases. So, the other piece of this that I'd like to just sort of, if you don't mind, challenge you on is just because your mom may have been using substances doesn't mean that the substance abuse was not an element of her managing her mental health and self-medicating rather than vice versa. So just because your mom had different symptoms doesn't mean that she wasn't suffering from tick diseases. And I know there's some research that showed that up to 60% of the people who are diagnosed with mental health disorders are actually suffering from Lyme disease.
That is very true, and I would explore that option if it weren't something that was genetic in my family. There's a long history of substance abuse disorders and mental health disorders on my mother's side of the family. Luckily, I didn't get past those genes.
Thank God.
But yes, but speaking of my brother passing in 2015, he wasn't as lucky. So yeah, I really think it's more genetic as far as from my mom's side goes, and in her disorders than from tick-borne diseases.
So let's talk about your autoimmune diseases and why you are now teasing them out from your Lyme journey. Why do you think your autoimmune diseases are not part and parcel of your tick diseases, and why perhaps you may have been suffering from these tick diseases since your childhood by coming in contact with the tick?
Well, very different clinical symptoms, just very much. So my onset of Graves' disease, I lost a lot of weight really quickly. It didn't matter how much I ate. I was eating like 4,000 or 5,000 calories a day, and I got down to 100 pounds. I just, my metabolism was super fast, and I didn't have the types of pains or nervous system disorders or the headaches or any of those things that I had that did start during my pregnancy and that were later used to diagnose on my clinical symptoms list that I gave to my clinician used to think about testing for Lyme disease. They were just very different symptoms. Although I do believe that now having a predisposition to autoimmune diseases, because I do have a lot of diseases that are genetic in my family. For instance, psoriasis I also have antiphospholipid syndrome, which is a blood clotting disorder. I have, of course, Graves' disease. And I was also born with the hereditary BRCA2 genetic cancer mutation and that comes from my mom's side. So the psoriasis and psoriatic arthritis comes from my dad's side. Speaking of psoriatic arthritis, it's actually what I first thought I had as well with the fatigue, because I did start having joint pain shortly after that, and I started seeing my rheumatologist in Miami. I thought that I had an onset of psoriatic arthritis, and luckily, because he's a great clinician, he ran a bunch of tests and didn't see the arthritis. He ran MRIs and x-rays and blood labs for RA and everything else, and nothing came positive. But he didn't say that I didn't have it. He said it's possible that it's an early onset and he doesn't see it yet, but he didn't give me a definitive diagnosis of psoriatic arthritis based on my clinical symptoms and family history. And that's important, because had he done that, I would have continued to think that I had psoriatic arthritis and never gone on to try to investigate why my clinical symptoms were continuing to happen. I would have never possibly found out that I had Lyme disease and other tick-borne diseases. So I think that, that was a benefit in my case.
Oh, for sure. I mean, having the blessing of a really good doctor, a really good clinician allowed you to continue to go on your diagnostic journey, and you didn't settle on something that you didn't have.
Right.
So it seems to me that you're beginning to sort of build out this, I guess, environment that you were immunocompromised and you came in contact with a tick, right? So you had a predisposition to having a compromised immune system, and then when you came in contact with the tick, it was a battle that your body wasn't prepared to fight.
Exactly. And my clinical decline happened fairly rapidly. By the time I was diagnosed, and I had Lyme disease diagnosed in a spinal fluid, so I had Lyme encephalitis, and I had other tick-borne diseases that weren't tested for at that time. But by the time that I had that spinal tap, which was in the fall of 2015, and 1 month away from also 1 month after me being diagnosed finally with a hereditary BRCA2 cancer mutation, I was the first in my family to test for it. So all of this kind of happened together at the same time, which also plays another role in my story. But by the time I was diagnosed with the spinal fluid having Borrelia bacteria in it, I couldn't recognize my own car. I had such cognitive decline that I didn't know what day it was. I had massive time distortion. I didn't know something happened today, yesterday, or 3 months ago. I couldn't remember if I brushed my teeth. I was asking my husband 100 times a day if I had brushed my teeth already, and then didn't remember that I asked him. So I was continuously asking him. I would make coffee with the coffee cup not under the maker or upside down. Like, weird things were happening. And at that time, I was also I was applying to grad school for a master in nonprofit leadership, and I couldn't focus on the application. I couldn't read anything. I was reading sentences 8, 9, 10, 15 times to try to absorb it. And it was so frustrating because I was like, what's happening to me? Is it because I'm tired? Is it because I'm a new mom? And I recall leaving a store and looking for my car in the parking lot. I knew where I parked my car. And I went up to this car to enter the car and said, this is not my car. And I probably spent a good 10 minutes going around this parking lot looking for my car and beeping, my alarm to try to find where it was, just to find out that that first car that I tried to enter was my car the whole time. And I didn't recognize it. And I got into the car and I just broke down crying. And I said, what is happening to me? Because that was like the high point of realizing there's something going on. I need to go back to my doctors to figure this out, because I was having really bad migraines, and I was wondering, one of my grandparents passed away from a brain tumor. So I was like wondering, do I have a brain tumor? What is happening to me right now?
So then before Matt takes you on the diagnostic journey, I want to walk back a little bit further. And again, thank you for being so open and vulnerable and honest. But I'd like to explore one other topic with you. You said that you were having some trouble. Getting pregnant, or you were having some trouble maintaining your pregnancies. And if you don't mind, I'd like to talk to you a little bit about that issue, because we know that's a big issue in the Lyme community, and it's something that people really don't like to talk about. But many people with Lyme disease cannot carry children, right? Their Lyme disease causes them to lose their children. And we had one example here in our community where we had a young woman who had lost 4 or 5 different, she miscarried 4 or 5 different times, and somebody actually recommended to her that she be tested for Lyme disease, and sure enough, she did have Lyme, got treated for Lyme, and has now since had, I think, 2 or 3 children since then. So that seems to be a pretty common phenomenon, but we don't spend a lot of time talking about it. So how do you know that you weren't harboring the Lyme disease when you were going through that part of your journey where you were miscarrying?
Well, I do know that the tests are poor, right? And looking back through several of my tests with my clinicians, I do know that at one point we visited IVF, and I'll come back to why we were going to IVF, although we never used them. They did run a lot of panels to see why I was having trouble. And we didn't realize at the time, because they only discussed what was positive, but they had run a Lyme disease panel, and it was negative at that time. So what's attributed to my persistent miscarriages was actually antiphospholipid syndrome, which is a blood clotting disorder, which is one of the reasons also that I was tested for that. So they did run several panels to try to investigate why I was having all the losses. I also had an ectopic pregnancy in 2008. So I had to have emergency surgery for that, and was in the hospital for a few days on methotrexate. And before the surgery, they had to remove the ectopic pregnancy. And then because of that, when we were trying to conceive in 2012 after other losses, my OBGYN decided to run a test to see if there was any scar tissue in that tube. And there was, and we had to then remove the tube to facilitate a healthy pregnancy, because they said that there was some buildup that would be caused by that scar tissue, and that it could be a 50% fatality to any fetus going forward. So we removed the tube. I was directed, or before I removed the tube, we were directed to visit IVF just to see what that would look like if we had trouble conceiving after the surgery. And so they ran a panel of tests, and that's when I was diagnosed with antiphospholipid syndrome, which made actually a lot of sense, because my mother had a stroke, her mother had a stroke, her mother's mother had a stroke. So there's also strokes that run in the family. So at that time, we know that the losses were due to that blood clotting disorder, and I'm on blood thinners daily now for that.
So Dana, I think your story is just a really powerful story on so many different levels, because it allows us to explore so many different pieces of a Lyme journey, right? And one of the things that we have observed through our past podcast guests, is that every single person has a different presentation when they have Lyme disease. And you're just sort of building out one of the reasons why your presentation, for example, would be different than Matt's presentation, right? Because you had a genetic predisposition that was very different than Matt's would be, for example. So your presentation would be very different, right? So that's why it's impossible to look for the thing to get you better from Lyme disease, because each one of us comes to this journey with a very different genetic predisposition. Each one of us comes to this journey with a very different immune system. And of course, each one of us comes to this journey with a very different set of microbes that are being spit into us. And when you put all of those permutations together, it's impossible to equate one to another, right? So talk to us about the testing before I let Matt spend some time with you on the testing. Let's explore testing a little bit, because you said you were tested for Lyme disease when you were going through the miscarriage journey. And were the tests that they were giving you at that time testing you for Lyme disease? And again, I know you were unaware of them, but you've now looked back at them. The same tests that were ultimately used to diagnose you with Lyme disease, because you said that you were initially diagnosed during this part of your journey through a spinal tap and spinal fluid. So they didn't, of course, initially test you through spinal fluid. So were there some differences in the testing, and perhaps could that be the reason why you weren't diagnosed early on, because of the flaws in the testing rather than not having Lyme disease at that stage?
It is possible, and I just want to step back a second too, because you're right. It host immunity is very important in this big puzzle of a picture, and of course, also the strains of Borrelia, because we know there's many different strain types, which can cause different symptom sets and different levels of disease as far as severity, and also of course comes into play co-infections and other tick diseases and other infectious disease types. So all of those things do play a role in how cases are very different. So again, going back, I never had heard of Lyme disease and did not know that I was tested for it during IVF at the time. I only was going through those tests when I moved to Maine, and because I was gathering all of my medical history files to bring with me up here for my new doctors, and that's the only reason I even noticed that they had tested also for a Western blot on all of those labs, because I wasn't looking for it. I wasn't looking for anything. I was just trying to bring the initial test for when I was going to be set up with a hematologist here in Maine. Of course, I was seeing a hematologist in Florida, and you have, with antiphospholipid syndrome, it takes multiple tests for that diagnosis. So I was gathering all of that stuff together. So it wasn't quite the same. They did run a Western blot. I was referred to the neurologist in Miami based off of what my primary care had tested. So through the process of me trying to figure out what was wrong, I only went to see two doctors. So it was my rheumatologist and my primary care physician. And I initially went to my primary care asking her if I had a vitamin deficiency because of the fatigue. And I asked her to run a vitamin panel. And of course that was fine. Even my vitamin D was fine, everything was fine. And so because of that, and because of the rheumatology test being normal, I assumed that it was an early onset of psoriatic arthritis, and that, I'm just going to wait until it gets worse. And then I'll go back to the doctor, and he's going to run some more tests and see then that it comes up in the scans. So it was about a year and a half later that I went back to the doctor. So during this time, I'm having really bad clinical decline, and didn't think, of course, still didn't at the time know about ticks or the dangers of ticks, but I was attributing everything to what I thought was a clinical diagnosis that I hadn't yet been given, but still decided to go back to the doctors and explore. So I made an appointment with my rheumatologist and with my primary care one day apart. I saw my primary care first. My rheumatologist told me to keep a symptoms journal of everything that was happening. He also asked me to try, 30 days of an anti-inflammatory. If it didn't help, stop taking it. So it didn't help, so I stopped taking it. But I took that journal with me to my primary care, and it was actually on my phone. And I was tracking weird symptoms and things that would happen and that I noticed frequently. And I went back to her and I said, did you happen to test for vitamin B? Because my fatigue is getting so much worse. And I'm not sure what's going on. I'm heading back to rheumatology tomorrow. And, all these other things are happening to me. And she said, well, what are those other things? And I told her, and she said, you know what? You sound like my daughter, and she has Lyme disease. So I want to test you. And this is a primary care in Miami. So, very unlikely that this is going to be the same experience with a lot of patients in Miami. But she tested me for rheumatoid arthritis, lupus, and I knew RA was already negative because rheumatology tested me for it. But she tested for RA, lupus, and Lyme and said those three things should always be tested together because they have the same types of clinical symptoms. So she called me a few days later and said, lupus was normal, RA was normal, but I did have a couple titers on my Lyme test. It wasn't positive, it wasn't CDC positive, but because of that and because of my headaches, my migraines, my clinical decline, she's sending me to neurology, and neurology did the spinal, and that was my first positive test. Of course, later I had many Western blots that weren't positive, even after a positive spinal, which is important to note because patients could have neurological manifestation and they could have neural Lyme. And as we know, Lyme is not, the bacteria is not a serum bacteria, right? And you need a certain amount in a serum sample to trigger a positive test. We also know that the tests are created out of one specific strain out of New York, and there's many different strains. And the further you go away from that, epicenter from where that strain is typically located, you can have, lower sensitivity and specificity on the test. So I had multiple negative Western blots after that. I did have some positive as well later on too, but it was just really odd to know that I had neural Lyme. It was definitely in my spinal fluid, twice the amount that was needed to trigger the titer. So it was a lot in my spinal fluid, and that based on serum tests, nobody would have ever known that I had Lyme disease.
So Adina, first I want to point out, how I think fortunate you were, and it's odd to say it this way, that your primary care physician thought of Lyme disease, especially in Florida, right? That's not very common. And even though you weren't positive, it was still suggested to you by your primary care physician, go to a neurologist because it still could be on the table. Again, very uncommon with a negative test, only a few titers. And then thankfully your neurologist did a spinal tap because all of your lab work, your blood work was showing negative. You had severe neurological Lyme disease, but yet your blood work was showing negative. And we get this question all the time. My symptoms are so severe. I'm so neurologically impaired. My test should be showing positive, but you're proof that that's not the case. You can be very, very neurologically sick from Lyme disease and still test negative with a blood test. And your spinal tap showed that, right? And you had double the levels of the bacteria in your body to be positive for your spinal tap. So I think it's a really important piece to emphasize here on this podcast. So thankfully, you had this diagnosis through the spinal tap. You're treating with a neurologist now. Do you decide to treat Lyme disease through the neurologist, or do you go to another doctor to develop a treatment plan?
Actually, that neurologist looked at my test and said, I don't know anything about Lyme disease. There was only a paragraph in my medical school books, but I can prescribe you something for your headaches. So she actually never tested me. And had she, or treated me, I should say, had she treated me at that point in time, I probably wouldn't be disabled right now, because although I don't have tick diseases anymore, I do have newly triggered autoimmune diseases. And that's, kind of where I think that my autoimmunity comes into play, because I have continuing problems and with my nervous system, and I need ongoing weekly infusions for the rest of my life. I'm using a mobility scooter to go anything a block away because I can't stand up. I can walk, I'm not paralyzed, but I don't have the stamina, right? And I don't have the endurance. So I need a mobility scooter to go a block. And I think that if she had just looked online, right? And I hate to use these words, it's a little harsh, but had done her job, and investigated a little bit, of what she needed to do and know that the recommended course of neurological Lyme is ceftriaxone, that we could have started my treatment at that point in time. So this was in the fall of 2015, because she didn't know what to do according to her, and because she didn't initiate treatment at that point in time, I started looking for a doctor who could treat me. Now, my primary care physician did put me on oral doxy, and she did give me multiple rounds. So I was on for a few months, but it wasn't helping, and I was continuing to decline. So I did find a doctor in Florida who was considered Lyme literate, and I would also, note that not all Lyme literate doctors are equal. So there's that as well. But so this doctor was considered Lyme literate, and was continuing to treat me on oral doxy, and it took almost about a year before this doctor attempted to treat me with a PICC line and IV ceftriaxone. So it was in 2016, in October, I remember, October of 2016, that I was inserted with a PICC line, and finally, attempted to have treatment with ceftriaxone, or brand name Rocephin. And then we realized quickly that I was allergic to it. Although I had gone to the allergist to be cleared ahead of time, they did a skin test for it. I passed the skin test. I ended up having an allergic reaction. They had to pull my PICC line. And it wasn't until January of 2018, so another year and a half going by, before I could get the proper treatment. And by that time, we were in Maine. I was seeing a neurologist who specialized in infectious diseases, and they worked with my primary care and my allergist in Maine, with the hospital system here, to get me admitted into ICU at Maine Med Hospital System. And I was at the hospital in ICU for 4 days, getting the treatment that I needed. They had to do what's called a desensitizing method to desensitize me to the drug so I could take the Rocephin. And that was the beginning of me truly being treated, because the oral meds over a long course of time did not help me whatsoever. That doctor also gave me the oral meds. He tested for Ehrlichia. That was it. I was positive for Ehrlichia. Ehrlichia was kind of treated fast, but not the Lyme. So I was on these oral medications. I also tried some herbal remedies that went along with it. Nothing helped me until I was on the IV Rocephin. Also, to note, it wasn't until that I was seeing that infectious disease neurologist after I moved up to Maine, that I was tested for all the other tick diseases. And I ended up in total being positive with Lyme, Ehrlichia, which I knew from Florida. I had Babesia, and these are CDC positive tests. I also had 2 strains of Bartonella, and I also had high titers to Rocky Mountain spotted fever. So I had to have been bitten by 2 different ticks to have that, because of the different species of what they spread. So I was really, really sick. And I also contracted chikungunya in 2017, which is a mosquito-borne, vector-borne disease. So I had 7 infectious agents at one time, and I was terribly sick. And as we know, these diseases can trigger, post-immune or post-treatment long haul symptoms like we see in COVID, right? Like you have this immunity triggers. And so I have just never been able to recover, although those diseases are now treated. I know they're treated. By the time I had the PICC line and went into the hospital for the desensitizing method in ICU, I was having seizures at that point. So I had continued to decline all this time while on oral meds until I got onto the IV antibiotic, and of course oral meds and the other medications for Babesia during that process as well in 2018. It wasn't until then that I got successfully treated. I don't have those clinical symptoms anymore. I'm a lot better than I was, but I do have damage to my body and to my systems that will never go away.
So Adina, I just want to highlight a couple of things you pointed out here that are really powerful, I believe. So the first thing I just want to comment on is that you mentioned that you had Lyme, Ehrlichia, Babesia, 2 strains of Bartonella, and likely Rickenmountain mountain spotted fever. But we've learned, and we just recently posted about this from an article we read, that there are likely many, many other tick-borne illnesses that we don't even know about, that we can't even test for, never mind identify what these are under a microscope. So who knows what else you were sick with from various tick bites throughout your life.
Exactly. And that is so true because, we seem to get, some tick diseases are fairly recent. They're just fairly recently discovered. And there are 20 known tick-borne diseases right now in the United States. And there's a variety of tick-borne diseases in other nations and that are also discovered. Different strains, like there's in Africa, in Botswana, elephants are, get Ehrlichia, just a little different strain than what humans get here. So we know about these diseases. And of course, there can be a plethora of other diseases that are unknown. We don't know about them. Of course, because they're not discovered, we don't have tests for them. There could be making people chronically sick, and we don't even know that yet. So it's very possible that tick-borne disease patients and other patients as well are infected with unknown tick-borne diseases or other vector-borne diseases.
So I'm also going to go way back to the point of when you first got diagnosed by your neurologist, because I think you made a really powerful observation there. And I agree with your conclusion. And I went through a very similar experience where when I was first diagnosed by an ER doctor, they basically said, follow up with an infectious disease doctor, get it. You probably need IV antibiotics, but it's going to take some time. So it would have been months before I can get into an infectious disease doctor. Thankfully, we had a neurologist locally who was friends with a family member and agreed to get me in immediately. And he disagreed with the ER doctor and said, no, you need IV antibiotics. I am not very familiar with Lyme, but from what I'm reading, you clearly have neurological Lyme disease and you need IV antibiotics as soon as possible because the oral antibiotics will not be as effective to treat your neurological symptoms. And your observation was if your neurologist did what mine did, he could have put you on those antibiotics much sooner and possibly prevented some of the damage you're now experiencing today, correct?
That is absolutely correct. And, I did see another neurologist at University of Miami who said that he didn't know anything about Lyme. The only thing he could do was test me for small fiber neuropathy. But at that point, he didn't think that anything would show up in those biopsies. But now I do have biopsies that show damage to my small fiber nerves. I don't think that they would have come positive then. I think that it's important. First of all, clinical education is lacking, right? It's severely lacking. And I do think it is important that all medical students know about the dangers of tick diseases, know the variety of clinical presentations across all of the pathogens that ticks could spread, know the difference between early and late stage clinical manifestations. So all of these things at a basic level, even so they can refer out if they don't understand how to treat. When I was in the hospital in Miami after the spinal tap, before the test came back positive, infectious disease did come to my room and ask me if I had traveled to New England at all, if I had gone camping, and I had said no. I was at that point in time I wasn't traveling, although I traveled extensively in my life. I've been to all 7 continents, and so we've done a lot of traveling. But I had it at that time, especially during this is after my pregnancy, right? In fact, my son was 1.5 years old when I got my first spinal tap. So I told him that we hadn't been traveling. We hadn't been to the Northeast camping. And he said, then, you don't have Lyme. Don't worry about it. There's no way that you can have Lyme disease. And this is a Miami infectious disease doctor. I did go back to his office with positive tests in hand. I was, all ready to advocate and say, excuse my language, you're an idiot. And here's the positive test, and here's all the information that you need to understand. But he humbled me before I got to call him that name. And he thanked me for coming by his office and letting him know that he was wrong, and to give him that information, and asked me if I would, keep in touch on my journey to let him know how I was doing. So, you know, sometimes I think it just takes a little bit of education. You, in your case, obviously, were very lucky. I wish that more neurologists understood that, or more doctors, anyways, if you're presenting with neurological complications, that, you know, IV medication is most likely needed. When I first moved to Maine, even the primary care doctor's office here looked at my files when I was getting established with new doctors, and they said, they treated you with oral doxy when you had a positive spinal? That's absurd. You need IV antibiotics. And I said, yes, thank you. You know this. That's amazing to hear this from a doctor. Thank you so much. It was very refreshing. Although there's still a lot of you know, misconceptions and a lack of clinical education in the Northeast. There's more, it's more known about than in Florida.
So Dina, give us an idea time-wise. So you got diagnosed, you then were put on oral doxy for quite a while before you got the first PICC line put in and had your allergic reaction. What was the time frame between diagnosis and the first PICC line that you had to have removed from the allergic reaction?
A year, 1 year.
And then from there, you had to go back on oral antibiotics until you finally went to Maine with your infectious disease neurologist, who helped you with this, I guess, desensitizing process to be able to handle the ceftriaxone for the IV antibiotics. And how long was that from the initial diagnosis now?
From the initial diagnosis, it was 2.5 years.
So you were diagnosed for 2.5 years with severe neurological symptoms related to a tick-borne illness, Lyme disease, and others, and you were not getting better on oral antibiotics, and they let you suffer for 2.5 years before you got proper treatment.
Exactly.
Talk to us about before you moved to Maine and saw this doctor who helped you with desensitizing and get on the Rocephin or the Ceftriaxone properly. Were you getting any better? Was the oral antibiotics helping at all?
Not at all. Not at all. And, you know, again, I was just continuing on this decline. I was diagnosed in the fall of 2015. In 2016, I at first had purchased a walker to use, and then we got a mobility scooter I needed to start using in 2016. In 2017, we were traveling in Asia, and I had my first seizure in a subway station in Singapore. And I was walking like I had muscular dystrophy. It was at this time that I started turning the camera on myself and filming myself with these clinical symptoms so I could show the doctors what was happening when I wasn't in their office. And yeah, it was the start of a journey and the start of LymeTV, which I didn't even know at the time. But yeah, it took a long time, and they've just let me decline basically because of lack of education. Really, it wasn't until I moved to the Northeast and got competent medical care that I was, you know, treated successfully.
So Adina, talk to us about, you know, your husband and your family. What were their observations over this 2.5-year window before you finally got proper treatment? Were they encouraging you to see other doctors? Were they getting frustrated with you? How, you know, this must have been a really difficult 2.5-year window for you while you were treating on oral antibiotics and not getting any better.
My husband is brilliant. First of all, let me say he has a PhD in historic epidemiology. He actually serves as LymeTV's director of science. He was always looking up and researching clinical and information. He was printing out robust peer-reviewed research to bring to the doctors to educate them as well with me. He was always in my corner. He, you know, he would come with me at the worst of my cognitive decline because I couldn't always remember things to tell my clinician. So he was there with me at my appointments. I don't think he was ever frustrated with me personally, but definitely with the lack of clinical education that wasn't helping me get better. We were definitely thrown in to this journey of tick-borne diseases, never knowing that ticks were dangerous, and just coming to understand that there is a schism in the medical community about tick-borne diseases and how on a different level, that it is so polarized, and we had no idea. So he helped navigate through that system. For my son, my heart was broken when he was tested for tick-borne diseases. He was complaining that his legs hurt, so we went ahead and tested him, and he was CDC positive on all the same exact strains of mine. He's healthy. Luckily, he's been successfully treated by an infectious disease pediatric doctor that specializes in tick-borne diseases in Connecticut. So he was treated for about a year on medication, and he's healthy. He has no tick disease titers anymore. We monitored that and even tested him 6 months and a year after treatment. He's well. Thankfully, not as many children are as lucky. But for him, I would say that he's lost a mother that he could have had. I don't have the stamina or the energy to be the mother that I really want to be. I also have hyperacusis and tinnitus, like sound sensitivity is one of the things that came out of tick-borne diseases for me. So having a child who's very talkative and brilliant as well, it makes it very hard, to spend a lot of time with him. So it's just hard. It's become hard on my family because they're my caregivers now. My husband was thrown into being a caregiver at such a young age, where we say we're too young for this, right? Like, of course I was lucky that I didn't have chronic illness in my teens or my 20s or as a young child. I got sick in my late 30s. And so all of this, I'm grateful for that, but all of this has been difficult on my family because it's not what we expected and of our lives and the journey that we wanted. Before I got sick and I was applying for grad school, my dream was to work, for project management and logistics on the ground in the field for Doctors Without Borders. Like, that was my goal. We were going to travel around the world. He was able to work, remotely, or he was going to retire early so we could travel and I could pursue my career dreams and goals of, working with international nonprofits on the ground without having to fly back and forth from the US. So yeah, it definitely changed our lives, but he's always been supportive, and he's always been very patient, and he is the best caregiver that anyone could ask for, and I'm very grateful for him. Very nurturing and very patient.
Adina, although this situation is horrible and a lot of it probably could have been avoided for almost all of us, right? I mean, if we just knew about Lyme disease, if we took better precautions to not get bit, or if we had early detection, we probably wouldn't be dealing with the long-term consequences we are today. But you didn't let that keep you down, and you went on and you're running LymeTV, and we're going to get to that in a bit and talk about how you are just helping so many people worldwide now, and that we're really excited to share that with the listeners in a little bit. But I do want to bounce back a little bit because now, so you're in Maine, you're treating with the infectious disease doctor who's also this neurologist, and you desensitize and you're treating with this IV Rocephin or Ceftriaxone, which is, I think, the generic name for it. Talk to us about how that actually started to help you.
Well, there's this term, right? Post-treatment Lyme disease syndrome. And so it's kind of a vague term because it could mean patients who are already successfully treated but still have clinical symptoms. And that could be due, obviously, to damage or secondary diseases. It could be because the patient's not yet treated and their clinical symptoms are ongoing. So we were kind of monitoring to see how long it would take for my symptoms to go away. And as the neurologist mentioned, that it's possible that I could get better and then later relapse. So we were definitely monitoring that along the way. And it took me I was on 3 months of antibiotics and a year of oral meds and antimalarials for the Babesia. And it took about 6 to 8 months for me to really start feeling better on those treatments. So we weren't yet sure if the medications were working up until that point. And I don't think that I got sicker while I was on the medication, on the IV medication. However, I do recall just being worried if it was going to work or not in my case, because by that time I had declined so much and it had been so long since I had been diagnosed.
Talk to us, just to recap, you were on how many months of IV antibiotics?
I was on 90 days. Actually a very short course, for some people, because I know that some people treat with it for much, much longer, but it took 90 days of that, plus concurrently, and then going further again after my IV had stopped, I was on other types of combination drugs of oral medication like Malarone and Mepron for Babesia and other types of other medications.
So do you think that the 3 months of antibiotics that you were on through the IV, do you think that they were really a game changer in your healing?
Absolutely. I was having muscle jerks and involuntary twitches, full body spasms, hand tremors. I during this process, I also had to get a shower chair, to sit down in the shower while I was bathing myself. And I still occasionally still need, because I had dysautonomia, but I was in much worse shape then. I didn't know if something happened today, yesterday, or a few months ago. The time distortion was pretty prevalent. I also had phantom smells. Like initially I would smell cedar chips, and then it went from a sweet smell to a really bad smell. I then started smelling cigarette smoke. And those kind of things I no longer have anymore. I would have regular daily severe migraines, and I don't have those kind of things anymore. So I know that the Lyme has been successfully treated because of those severe clinical symptoms that I had. They're gone. I no longer have those.
And talk to us about specifically what other medications you took to address the various other co-infections. So I think you kind of touched on it twice, but if you can give us a little more detail, what did you do specifically to treat the Babesia? Was there anything specific for the Bartonella? If you can kind of help us narrow down what treatments were targeting what pathogens.
I don't remember all of them because there were so many, but I think that I was on, I know I was on Mepron and Malarone, and I also was on, I don't know what all the rest of the oral meds were. There were just so many of them. There was a large combination of drugs. I think, I'm sure that in the neurologist's clinical experience, she knew what to prescribe, but there was such a large combination that some doctors may just prescribe one or two of them, and she just kind of did this large combo. But it helped, whatever it was. I want to say also, I can't even remember what.
No, but I think even at its core, the fact that you were taking the Rocephin for this broad spectrum IV antibiotic, which can address Lyme and many of the co-infections, but we know that Babesia is different and we need a different treatment. So you use the Mepron and the Malarone for the Babesia. Those two together are really the 1-2 punch you probably needed to get your body restarted.
Absolutely. And I'm grateful for those drugs and for that neurologist.
So you mentioned you were on the IV antibiotics for 90 days. Were you on Mepron and Malarone in parallel, or were they done, sequentially after the IV treatment?
Everything was done in parallel, and it continued after the IV treatment. So the other combination of drugs were long-term, for what a typical clinician would consider. So I was on those other drugs long-term. The shortest part of that path for me, that treatment path, was the Ceftriaxone for 90 days, plus the time that I had in ICU when they were desensitizing. So it was really 94 days.
So the Ceftriaxone, when you were done with the 90 days, talk to us about the symptom improvement. So is that when your phantom smells were gone, your time distortion was gone, your migraines were gone, that all those symptoms subsided after the IV?
It took a while. It took some months for everything to slowly kind of recede. I also had, other symptoms like, Bartonella, people say brings rage, right? Like there were times that I would get so angry over really nothing. And that took a while too. But over time, all these things did subside. It wasn't immediately. It took about 6 to 8 months for these clinical symptoms for us to really notice that I was improving.
It really took 6 to 8 months for you to even see the progress.
Right.
And how long were you on the other medications beyond the IV for? So you mentioned it was more long-term, but give us an idea. Is that a year, 2 years?
They were about a year, almost a year.
So 6 to 8 months in, you're realizing, wow, this is actually working. I'm starting to feel better. And then we're talking about now a year. So another, 4 to 6 months later, after you start to see the progress, you stop treating with these other drugs like the Mepron and the Malarone to treat the other various co-infections. How are you feeling at the end of that 1 year period?
I felt a lot better, although I still have, as I mentioned, damage to my body and other secondary diseases that are now triggered. So I'm dealing with those clinical symptoms in decline. I have been diagnosed with CIDP, which is a chronic inflammatory demyelinating polyneuropathy, which is a demyelination of the large motor nerves. I also have small fiber neuropathy, which really they don't demyelinate because they don't have myelin, but there's damage to those nerves. And that could manifest on its own as having dysautonomia. There was a study published in February 2019 by Dr. Peter Novak at Harvard on the manifestation of small fiber neuropathy as dysautonomia in post-treatment Lyme disease patients. So there's research on this. So I've been diagnosed also with dysautonomia. So there's three basically degenerating or degenerative nervous system disorders that I'm having to take IVIG for on a weekly basis. We've tried, I've been off of IVIG a couple different times and I've declined through the process. So now we know that I'm going to need to remain on it. And, but those symptoms are different than the other ones. So although those were gone, I still wasn't well. I wasn't well when I knew my tick diseases were gone, when those very specific symptom sets subsided and I did improve, my cognitive issues improved. I still sometimes have word recollection issues. I still sometimes, may forget something minor, but I remember if something happened. We used to travel and it was almost like my short-term memory wasn't converting to long-term memory. So we had traveled to places that I have no recollection at all of being in that place. And now I remember, I know what day it is. I know what I ate for breakfast this morning. I know if I brushed my teeth. So, those things have certainly improved, but I am not well by any means. I still have a lot of ongoing health issues.
So when did the symptoms of these three degenerative nervous system disorders pop up? Did they pop up while you were treating? And how are you able to identify those symptom sets versus the symptom sets that were correlated to your tick-borne illnesses?
Yeah, so it was the same neurologist who treated me, who got me into ICU in 2018. It was just a couple months before, like a month or two before, that I was diagnosed with CIDP through a series of EMGs and other neurological tests. And then I was also referred to at the same time by a cardiologist in Maine because I was having some cardiac issues. They ran a bunch of Holter tests. In December of 2017, as I was waiting to go into ICU, I also was back and forth into the ER because I was having a lot of heart issues and I was having abnormal EKGs that were recorded in the in the emergency room. And they suggested that I see a cardiologist, and the cardiologist ran a bunch of tests and suggested that I go to Brigham and Women's Hospital in Boston, that they have a dysautonomic center. And so I was referred to go there, and it took about a year to be seen. At that point in time, I was tested for autonomic dysfunction through a series of other tests, including small fiber biopsies, nerve biopsies, tilt tables, the whole works, and was diagnosed with dysautonomia in 2018. So CIDP came at the end of 2017. Later 2018, I was diagnosed with small fiber neuropathy and dysautonomia.
It sounds like you were better from your tick-borne illness, but you now were dealing with damage from all of the conditions you had. And I think it's hard for people to identify what is potentially still persistent infection or persistent tick-borne illness and what is based on something that could be damaged as a result of the tick-borne illnesses. So if you could just at a high level list the 3 names of the degenerative nervous system disorders that you had, so our listeners can explore it with their doctors if they think that they might be suffering from damage from Lyme disease versus, actually a persistent infection from a tick-borne illness.
Yeah, absolutely. Because, somebody can have active tick-borne infections or any type of active pathogen infection, right? Not just from tick-borne diseases, and they could trigger these other diseases and cause damage in parallel, and then they can be contributing to the decline of the patient that has these infections. And again, we see this with COVID, that COVID is triggering dysautonomia in patients and other types of nerve damage that we're seeing now. So as far as my case goes, with because they are different symptom sets, for the small fiber neuropathy and dysautonomia, I get a lot of burning and tingling in my limbs, my fingers, my feet, my legs, my arms. It doesn't stop. It's persistent. It feels like, those, like when your arm is asleep or something's asleep and you have all that tingling like ants crawling. It's persistent. It happens all the time. The severity may change. Sometimes it's like the volume is really high on it and I have a lot of intense tingling versus something that might be more low lying, but it's always there, even right now as I'm speaking. And also I have intolerance when I stand up. So my blood pressure can drop, my heart rate increases, so I get palpitations, I can get dizzy, and I have low stamina. So I can't stand up for a long period of time. That's from dysautonomia. Very similar to symptoms of POTS. However, I don't have POTS. There are different types of dysautonomia, and my symptoms can happen even when I'm in bed. I can have my heart rate spike up to 150 doing nothing at all. My blood pressure can get into hypertension doing nothing at all. I don't have to stand up for my blood pressure to rise or drop. Also, after I eat meals, I get what's called postprandial hypertension, and so I can get really low blood pressure and heart rate and feel really dizzy and weak. Like I just have to lay my head down on the table. And because I have dysautonomia, I also get and have the nerve damage. I have gastroparesis, and that's part of all of the nerve damage that I have as well. So I have to eat my meals. And first of all, for the postprandial hypotension, I have to eat small meals anyways. But because of gastroparesis, it's a slow motility of the gastric system, and I have to eat small meals just so the food can digest, because my food doesn't digest at a normal rate. So first of all, I'm never hungry. I eat on a schedule, because I know I need to eat, and I also have to do things like make smoothies with the Miralax to make sure things are going. I'm specifically seen by a internist doctor, GI doctor for that. So I have many different specialists that help me manage the damage done. And yeah, so patients could be experiencing these secondary diseases and not understand that those are in itself clinical diagnoses, and that there are diagnostic tests to test for this. Like I had to go through a very specific test to be diagnosed with gastroparesis. I had to go to a nuclear medicine hospital and eat a radioactive egg sandwich, and then they scan to see how fast that food is going through your system every hour or two. So all of these things are done with very specific diagnostic tests, and patients should advocate for themselves. If their doctors aren't sending them to specialists to monitor what's happening specifically in those systems, like if they're having neurological symptoms of tingling and burning and they're not seeing a neurologist, or they're having issues in their gastric system and not seeing a GI doctor, advocate and say, I want to go to this doctor. I think that I should be seen for this or tested for this, because those things in themselves are diagnoses. They can happen on their own without tick-borne disease. They can happen because of tick-borne disease. You could have them together with tick-borne disease, and those things take different treatment paths. And they need to be monitored, and they need to be put in someone's medical file so other clinicians know the whole scope of damage that's happening to these patients.
I just want to do a high-level overview. So dysautonomia is different than POTS because it can happen while lying down in addition to standing up. And POTS is primarily when you're standing up. You have a fluctuation of blood pressure and heart rate, which could be, a drop or a spike, essentially, right? It could be either or, I think. And with dysautonomia, it can happen even just laying down in bed. You can have these spikes.
Well, POTS is a form of dysautonomia. Dysautonomia has many types of dysautonomic diseases or disorders under the umbrella of dysautonomia. I have a general form of dysautonomia. There's some dysautonomia types that are hereditary. Some, like POTS, there is only happens when a patient is standing up for that intolerance of postural intolerance, and then there's patients that can have the symptoms regardless of what's happening. So there's a variety of different types of dysautonomia, and POTS is one of them.
So how do you get tested for dysautonomia?
Well, you have to see a neurologist who specializes in dysautonomia. And in my case, I'm in Maine, but I travel to Boston, which is just an hour and a half away. I have a referral to see this doctor. My insurance pays for everything. And I go and I initially saw this doctor. He ran a bunch of tests. He is the one who first indicated that I should be on IVIG. I have several neurologists in Portland who help manage my case locally for CIDP. They defer to my Boston neurologist for dysautonomia, but the ones here actually treat me and order the IVIG for me because they're local. So if I have, any issues with it, I just write them. So they all work together as a team. It's a big team effort, but you do have to see a neurologist and hopefully a neurologist that has the testing equipment, because it's very specific equipment. Although even if they don't have equipment in their office, you can see a neurologist. Most neurologists can do a nerve biopsy. So they can do some nerve biopsies to see if you have small fiber neuropathy right in their office.
Adina, you mentioned a specific test to get diagnosed with dysautonomia. What exactly is this test and how is it performed?
Well, the tilt table is one of the tests, and it's very, I guess there's no other name for it. It's a tilt table. They strap you in on a table and they tilt you at a certain degree, and they monitor your heart rate and blood pressure. You're hooked up to a bunch of machines, so they see the difference of you lying down versus being horizontal versus being vertical. Also, they test for your sweat output. So for me, for instance, my sweat gland nerves are damaged through all of my nervous system is damaged. In my ear canals, I have hyperacusis and tinnitus, like all the time. I have ringing in my ears, and I've had testing for that through an audiologist to show my nerves are damaged in my ear canal. But for my sweat glands, they have showed through this specific testing, I don't know the name of it, but they test your sweat output, and my sweat gland nerves are damaged, so I don't sweat, which also makes it difficult for me to have temperature control. So when it gets really hot, I feel faint or can pass out. So I have to stay cool, which is what I love about Maine. I am so glad to be away from the insufferable heat of Miami and to be in the cooler weather of Maine. So they do the sweat gland test. They also have some kind of mechanic device that they put on your head that tests some kind of like oxygen or carbon dioxide input output of your brain through this whole process as well. They do a breath test to check, and you have to breathe through a tube really hard. It's almost like what a pulmonologist would do, but sort of different because they're monitoring your blood pressure and your heart from your breathing output. So they're testing a lot of these different aspects of your heart rate, your blood pressure, your nervous system, your sweat output, all of these different things, and also while you're horizontal and vertical.
So how are you managing now? So obviously, well, I guess before I even ask that question, I do want to ask, it's such a controversial topic. Can you ever fully eradicate tick-borne illness once you get to the late stage and it took you so long to get diagnosed? And you made a statement that you feel that you've basically gotten rid of all your tick-borne illnesses. So do you think that they're fully gone or eradicated from your body? Or do you think that they're just there and you're now managing them because you treated them so well with all the treatments you got through this doctor in Maine?
I think it is controversial about if they can be treated or not. And I do believe they can be cured, but you can be left sick for the rest of your life. You can have, this like long haul Lyme, right? Or long haul like COVID. You just remain sick. You never become better because of what the infectious agents has done. And again, it's not just with tick-borne disease or with COVID. We see this with tuberculosis and other types of infectious agents. You can have long haul symptoms that remain long after you're sick. And in my case, I consider myself in poor health. Most of my energy, is I work from bed, but most of my energy is focused very specifically on my nonprofit work, and there's not much else of me to give because treatments, they're exhausting, and going to the doctors, it's exhausting. All of these things are exhausting for a patient. And I just want patients who are listening to know that it is possible, I believe, to get rid of your tick-borne diseases, but what may be keeping a patient sick could be these secondary issues or these newly triggered diseases that are being undiagnosed if the doctors aren't testing for them. You need these very specific diagnostic tests to know what's happening. And it sucks. It really sucks because I want to be better. I fully believe my tick diseases are gone because I don't have the seizures anymore. I know what day it is. I can read a paragraph and retain it. These things are very different than what they once were. And just to note, because it's not something I mentioned earlier, I had another spinal tap in 2018, and I had biomarkers of an Alzheimer patient and a brain injury patient. I had high S100B and high myelin basic protein. And so it showed that I had damage done that's, that it's there, and my nervous system is damaged, is there. It's proven through these diagnostic tests. And I don't think that I'm ever going to get better from these things.
Well, I think, Adina, you're being a little too hard on yourself as far as what you're giving back to the world today. I mean, you're running LymeTV. It's known around the globe, frankly, and the impact you're having in the Lyme community is amazing. So talk to us about the work that you're doing with LymeTV, and really, when did the first thought of developing this not-for-profit come into your mind, and how did you bring it to fruition?
Well, I got really angry at a doctor. And I looked to my husband and I said, there's got to be some kind of a change. I know that there's wonderful organizations doing a lot of amazing work, but for me, in my small little world, I said, I have to do something to help change this, because this doctor, most of my doctors have been amazing, and all of my specialists, although they don't know how to treat Lyme, they know about the damage done to Lyme. So there are good doctors out there. There are Lyme-friendly doctors, even if they're not fully Lyme literate. They understand and they can treat what they specialize in. And I have been lucky. But there's this one doctor in Maine who I actually brought to the Maine Medical State Review Board because they were so negligent and so dismissive and so biased. And they got reprimanded. They have a letter. They weren't put on probation, maybe because they didn't really harm me, but what they did was so reprehensible to the medical review board that they got a letter in their file that states your words were dangerous and that shouldn't happen. And that letter is in their file for 10 years. And I believe it can be searched for publicly. So if they get another complaint, maybe they'll then be on probation. But I got so upset and I said, something has to change. I am working in public health and as a patient and as what I feel a patient rights advocate. I've always advocated for human rights, and now as a patient rights. And so it upset me so much. And I said, I want to do something about this. I want to help make this change. So I wanted to form an organization that easily compiled all of the most robust peer-reviewed data on the topic in one place, easy for doctors to read. It's just, here it is, and for patients to gather and bring to their doctors. So it's on our website. We have a doctor section. There's a plethora of excellent, peer-reviewed research that's on there. Of course, not all research, even if it's peer reviewed, is excellent, or it may not have a solid conclusion, right? So we're very particular about, what we put on the website, and we do a lot of reading through this research. But that wasn't going to be enough. Just that alone wasn't enough. And as you mentioned, earlier, that education comes, is best in the long term with good retention and involvement when people are entertained, right? So we decided that we wanted to have programs to prevent tick-borne diseases in the first place. So if somebody's listening who doesn't know, LymeTV is a public health 501c3 registered nonprofit, and our mission is to reduce the incidence of dangerous tick-borne diseases through prevention, education, and outreach. We're an all-volunteer team. We're a diverse team of patients, advocates, and caregivers. And so part of our programs include free school health education for children, so they do not get a tick bite or become, they're tick literate, tick disease literate, and they know what to do if they get a tick bite, how to prevent a tick bite. So we have these programs, and we designed a curriculum that is fun and age appropriate for kids. You want the students to pay attention, and you want them to retain the information, right? So it has to be fun. It can't be boring, literature that a teacher's just, reading to the kids. You have to make it engaging and fun. We also have community outreach programs, which include us reaching out to the homeless community in Portland because they sleep outside and they're at high risk for tick diseases. So we provide them with free bug repellent and permethrin treated socks and tick education. During the pandemic, we haven't done any in-person health events. So we provide our community partners who work with the homeless communities here, who are shelters and maybe like clinics that serve the homeless community. We provided them with all of this stuff during the pandemic, and they're doing direct distribution. And then we also have our film projects, which we try to, it was founded, LymeTV was founded on the concept of educating through video and other visual media to reach a wider audience. And of course, our communication efforts use humor and engagement, since we want people to retain the information better. So we have our PSA series, which we try to have it be a little funny. We have our TikTok series, and then we have an informal dialogue series. And we also are filming a scientific documentary titled Lyme: Shifting the Paradigm, that we're working on, that is not funny. It is very scientifically focused, and we hope that shifts the paradigm on Lyme disease education. Just like through history, there's been many diseases that took a really large paradigm shift. Even after research was published, it took a paradigm shift for the medical community to accept that research. So that's the goal of our film, is to help educate on the latest, greatest science on Lyme disease and tick-borne diseases.
We just want to encourage everybody listening to go check out your website, is lymetv.org. there is so much powerful information on there, and it's all peer reviewed and accurate information you can share with your friends, your family, and even your doctors. I mean, you have information all about just what is Lyme disease, how does the testing work, what are the symptoms and early diagnosis, what are the dangers of late stage Lyme disease, cardiac Lyme, pregnancy on Lyme. And you also have a whole section for clinicians, which I think is really powerful, because there are doctors out there who will say, I don't know much about Lyme disease. And the more resources like yours, Adina, and LymeTV we can provide to our doctors who are open-minded and willing to learn, the more educated they can become, and the more people they can help in mass. And I think it's really important that people go to your website, read to gain information personally, but also to share with their practitioners to gain even more knowledge to help even more people at large. So talk to us a little specifically about your Tick Jedi program. I know there's been a lot of talk about the Tick Jedi program. We actually helped moderate and host an event with Ali Moresco for the Advocacy Express group, and we interviewed some elected officials, and we had Jennifer Hoffman on, who talked all about the Tick Jedi program and what you're doing to help get education into schools so these young children can learn about ticks and the dangers of ticks, and how to avoid getting as sick as you and I did, frankly, and understanding the real dangers of ticks. So talk to us about the Tick Jedi program and what inspired that program for you to really be so passionate about, to bring across really the entire country.
Yeah, thank you so much for asking. I'm really excited about Tick Jedi. The concept stemmed from our school health education program, which is actually called LymeTV's Tick Jedi School Health Education Program. And we decided to write a bill that would ensure that tick education is presented in the mainstream K through 12 school systems in their health science curriculum. So I was like, this schools are not required to have this education, and each school that uses our program currently, they, it's at their discretion. So during the pandemic, we had created a cartoon of our curriculum, so we could have a wider distribution. It's not very scalable to go to a school in person or even do Zoom calls one by one, even if we had a team of volunteers doing it. So we decided to create an interactive cartoon, which is a lot of fun for the students, and it could be distributed nationwide, worldwide. It's free for schools, youth organizations and camps. So we decided that, hey, why don't we try to champion a bill on a state-by-state level that would ensure that schools are using not necessarily our program, but any evidence-based and evidence-informed tick bite curriculum for the schools to learn, because students should be learning the dangers of ticks, how to protect themselves, what to do if they get bitten, what to do afterwards, what to look for afterwards to know the clinical symptoms and signs. They're going to teach their parents this information, and they're going to grow up with the factual information about ticks and not with misconceptions that we actually widely hear at our health events from adults, right? So the Tick Jedi bill was created, and it's actually, the acronym of Jedi is Juvenile Educational Defense Initiative. So we have our Tick Juvenile Educational Defense Initiative bill, and so far we have support in 2 state chambers, and we started asking support from our peer organizations if they would like to get involved, and it has grown really big in a very short amount of time. It's only been about a month, and we have I believe like 10 coalition members. So now we're called the Tick Jedi Coalition collectively, and our mission as a coalition is to champion the tick safety and prevention education and mainstream K through 12 science curriculum, so children can live healthier and safer lives. It's so important that we focus on the health of children. They're our future. When people are sick, it reduces GDP output, right? People become they're taken out of the workforce, even as adults, and also so it becomes an economical concern, and also cost of healthcare skyrocket when people have chronic illness and they're constantly in the medical system. And ticks are a public health issue. There is a public health crisis when it comes to ticks, and with ecological changes and other factors, this trend is going to continue, and everybody needs to know how dangerous ticks are. So we became a coalition that's an alliance of organizations, advocates, and patients to champion the bill, and we're pretty excited about it.
Well, Dina, if you don't already know, we had spoken to Megan Bradshaw about a month ago, and Rich and I have pledged the full support of Tick Bootcamp to support this initiative and join the coalition. So whatever we can do to help, we are here for you, and we want to see this succeed. And in fact, we had one of our elected officials, whom Rich and I know personally, equate this to recycling, right? Because one of the things we do at the government level is we try to educate young children about recycling, because they take that information home. They're like sponges. They take that information home and they tell their parents and their grandparents and their cousins and whoever they can talk to about what they've learned in school that day. And now that knowledge gets transmitted and more people recycle. And we've seen that work at the government level, and that's a very successful approach. And you're kind of modeling that to say, hey, look, we want to educate young children about Lyme disease and tick-borne illness, and they're going to go home and tell their parents and their grandparents and their cousins and their uncles. And who knows how many people's lives they're going to change by just sharing that information. Maybe somebody who has chronic Lyme and doesn't know it, or on the other side, prevent somebody from getting chronic Lyme because they're more aware about ticks, they're taking proper prevention steps, or possibly even detecting an early case of Lyme disease, right? So that's kind of the model I think you're taking here, to get it at its origin and prevent these things from happening and spreading awareness with children. I mean, that's a really, really great cause. So I do want to ask, because, again, we are a happy contributor to the Tick Jedi program, but it's not just for Lyme groups like LymeTV and Tick Bootcamp. It's also for individual advocates and people who just want to help in the community. So if somebody's listening and they want to help and they want to participate and they want to see what they can do to help the Tick Jedi program, how should they contact you? Where should they go to learn more, to participate in this great coalition that you're building?
That is a great question. If they go to lymetv.org, on the page, we have our Tick Jedi Coalition page. There is a form that people can sign up to volunteer, and the form will ask them about their professional background, what skills that they have, so we know exactly what department that we would place this person in, and for our current needs, we would take a look and try to match them with our current needs. We have several departments that have already grown. This is a separate organization, the LymeTV now. We're in the process of forming our 501c4 versus a 501c3 as a public charity organization. A C4 is a lobbying organization, so we'll have unlimited lobbying restrictions. It has a separate volunteer team and separate board of directors than does LymeTV. But yeah, we're working in tandem because we are spearheading the initiative, but it is a collective effort, and we are stronger together. So the more people who want to volunteer and get involved and who are able to help champion this bill in their state, we welcome everybody to come in and join, and to reach out to us and just fill out the form on the website and we'll reach out to them.
So I think the stronger together concept has really been played out through your entire journey, right? I mean, your entire life, you've realized that it's been teamwork to get you better. You mentioned you have a team of doctors that span across a couple of states, and that team of doctors together are helping you improve your health. And even before you got diagnosed, it was your husband, and it was family support and friend support together that helped you get to where you are today, right? And you're taking what you've learned and carrying that concept forward now to the Tick Jedi program, to be stronger together, to make real, huge change in the Lyme community by taking all these groups and bringing us together to have our voices be heard, tenfold, right? So I also do want to challenge you on one thing, because it's been bugging me the whole time, that you mentioned earlier that you wanted to get better and you wanted to go travel and you wanted to go live somewhere else and move on with your career, but you couldn't because you're still sick. And I want to say that I think what you're doing now is far better than any other aspiration you have had, because you are literally saving lives, right? LymeTV, the Tick Jedi program, you are saving lives across the globe. And I understand that you had certain desires and hopes and dreams, but I think sometimes fate takes over. And if, depending on your faith, if you believe in God, I think God kind of pushes you in a certain direction. And this is your destiny. I mean, clearly you are a very smart individual, Dina. You're able to bring together all these groups, and you've already made such change in the community, and we can see you're going to be making so much more change in the near future. So what do you think about that? Do you still have, I guess, sorrow over your lost career trajectory despite everything you're doing to help the community today?
It took me many years to go through the grief of loss of the career that I wanted, and the loss of my health in some aspect some ways. I still grieve my health. I don't think I grieve so much the trajectory of my career as I once did, because I see that we are making change in the public health sector. It's very important to me. I am now doing my master in public health. I am currently in a master of public health program, so I'll have my MPH and hopefully at some point my doctorate in public health as well. So this, while it did take me on a different path, it's still somewhat aligned of what I wanted to do. I am still, obviously doing project management and logistics and everything for the organization I founded instead of for another organization. But the difference is I really hate talking about ticks and tick-borne diseases. I have arachnophobia, and ticks are disgusting to me. So, I guess every organization's goal should be to want to shut down, right? Like you want to solve that problem so you don't have to exist anymore. And at some point, I hope that LymeTV doesn't need to exist anymore. I hope that we get to a point where people know about the dangers. It also becomes like a social behavioral issue. Like people may know about the dangers, but still not take the precautions they need, right? People know that, smoking causes lung cancer, but they still smoke. So there's, it's not just the public health challenge with tick-borne diseases. It's on a variety of public health issues, but this is my path now because this is something that's important to me. And I didn't know anything about ticks. I didn't know they were dangerous, and I am committed and dedicated for the rest of my life that as long as it takes, that we as an organization and me personally, I'm just going to continue marching forward on this mission to prevent tick-borne diseases. There's great organizations that fund science and have support groups and help patients and treatment grants, right? And we're focused on prevention. And it takes all of these organizations though together to try to help solve this problem. And there's been orgs that have been in existence for decades, and the problem like ticks are a problem that's continuing to persist. So all of us, I think together, with all of our different missions, at some point, I hope we can solve this problem so we don't need to exist.
So Dina, our final question before we conclude this podcast is, if your husband walked in as soon as we finished recording and told you he was bitten on his leg by a tick, what would you do?
Well, he would know, just as much as me on this, but I would tell, I would immediately remove the tick properly with fine tipped tweezers. Never use oil or fire or Vaseline on a tick. You want to remove the tick with fine tipped tweezers at the head of the tick. I would firmly and gently remove that tick, and I would save that tick and send it immediately to a tick testing lab because I'm going to want to know what pathogens that tick is infected with. And I would also, seek a prophylactic course of doxycycline at least while we're waiting to know what pathogens that tick is infected with. It may not even have Lyme, right? The tick might have Babesia, and then he'll have to switch medications. There could be a plethora of diseases that tick can transmit, including multiple at once. So definitely remove the tick properly, save the tick, send it for testing. And, there's a different consensus on this. There's, different people think differently on this, but as for our household, we would get on prophylactic medication.
Adina, thank you so much for joining our Tick Bootcamp podcast.
Thank you so much for having me.
Thank you for listening to the Tick Bootcamp interview with our guest, Adina Bercowicz. To our listeners, we have a call to action. First, if you'd like to learn more about Adina Bercowicz, please visit our Instagram page at LymeTV. Second, if you enjoyed this episode of the Tick Bootcamp podcast, please share it with your friends by using the social media buttons you see at the bottom of our post. Third, Tick Bootcamp has created a Tick by Blueprint that has been inspired by the information that has been provided to us by past guests on this podcast. We urge you to visit our website at tickbootcamp.com to view the blueprint. Please note we would appreciate any input or any improvements you would like to share with us on the blueprint. Fourth, please don't forget to subscribe to this podcast on Apple Podcasts, Google Podcasts, or Spotify to get you automatic episode updates of our Tick Bootcamp podcast. And finally, we thank you for your comments on our past podcast episodes. Please take a minute to leave us an honest review on Apple Podcasts, on Instagram, or on our website. We make it a point to read every single one of the reviews we get. Thank you for listening.